Welcome back. I'm Rachel, and in this video we're going to go over the structure of the trapezium bone. This bone is also known as the greater multangular bone. The trapezium bone is located when in anatomical position on the lateral side of the wrists of each hand. If we look more closely at the back or dorsal view of the right hand, we can see highlighted in red the trapezium bone amongst the other wrist bones. If we look at the palmar view, we can again see highlighted in red the trapezium bone. Now we are going to look at the different landmarks and features of the trapezium bone. Here we have the anterior view and the proximomedial view of this bone. This bone has 6 surfaces. The first of these surfaces is the palmar surface. This surface is roughened and has a tubercle on the proximal region of the surface. Medial to this tubercle is a groove for the tendon of the flexor carpi radialis muscle. The second surface is the dorsal surface. The third surface is the lateral surface. This surface is roughened for ligament attachment. The fourth surface is the medial surface. This surface is slightly concave and has a facet on it for articulation with the trapezoid bone. This surface also has a small distal facet for articulation with the second metacarpal bone. The fifth surface is the proximal surface, also known as the superior surface. This surface is also slightly concave and has a facet on it for articulation with the scaphoid bone. The sixth and final surface is the distal surface, also known as the inferior surface. This surface is concave and has a facet on it for articulation with the first metacarpal bone. This surface is considered cellar-shaped, in other words, saddle-shaped, which is why it is also sometimes referred to as the cellar surface. Let's now take a closer look at the articulations this bone has with other bones. This bone articulates with 4 other bones. The first of these articulations is with the trapezoid bone. The concave facet on the medial surface of the trapezium bone articulates with the facet on the lateral surface of the trapezoid bone. The second articulation is with the second metacarpal bone. The small facet on the distal end of the medial surface of the trapezium bone articulates with a facet on the base of the second metacarpal bone. The third articulation is with the first metacarpal bone. The facet on the distal surface of the trapezium bone articulates with the base of the first metacarpal bone. The fourth and final articulation is with the scaphoid bone. The facet on the proximal surface of the trapezium bone articulates with the facet on the distal surface of the scaphoid bone. What about the muscles that attach to this bone? This bone has 3 muscle attachments. A portion of the abductor pollicis brevis muscle originates from the tubercle on the palmar surface of this bone. The opponens pollicis muscle originates from the palmar surface of this bone. The superficial head of the flexor pollicis brevis muscle also originates from the palmar surface of this bone. And that concludes this video on the structure of the trapezium bone. I hope you found it helpful.
Thank you for watching. If you want to support this channel, please subscribe and check out more of my videos.